Hello everyone, welcome to this new series on science in radiology. So this series is going to consist of 4 videos and we'll see all kind of signs that we encounter in radiology. So let's see one by one. So what we are seeing here, this CT lung window is showing a patch of consolidation in the subpleural region and curvilinear areas of opacities which are extending from this area of consolidation towards the ipsilateral hilum. And what is this sign known as? This is known as comet tail sign, and it consists of curvilinear opacities that extends from the subpleural mass towards the ipsilateral hilum. So this sign indicates round atelectasis. It is similar to the crow feet sign, which is also described in round atelectasis, and it consists of again linear bands which radiate from the mass towards the ipsilateral hilum. Next case. So what we are seeing here in this radiograph of leg, distal leg around ankle region. So this is showing a radiodense mass with, sun ray type of periosteal reaction. So this is known as sunburst or sun ray appearance, and it is described in osteosarcoma of bone and in meningioma and in renal angiomyolipoma. So this is basically sunburst pattern of periosteal reaction. What is happening in this radiograph? This pelvic radiograph is showing separation of the pubic symphysis and there is a fracture here. So this is open book pelvic injury, which results from anteroposterior compression, and it results in injury and fracture of both the anterior as well as posterior arches. So anterior arch injury can involve pubic diastasis with or without pubic rami fracture, and posterior arch injury involves sacroiliac joint widening or diastasis with or without fracture of posterior ilium and sacral ala. So this is open book pelvic injury. What is happening here? This is not an open book pelvic injury. This is manta ray sign, which is seen in bladder exstrophy and congenital pubic diastasis. So this is different from the open book fracture that we seen in the previous case. Next, what is happening here? We can see this is MRI abdomen, axial T2 fat sac, and we can see gallbladder with multiple tiny foci of hyperintensities within the wall. So this indicates string of pearl or pearl necklace sign, which is described in adenomyomatosis of the gallbladder. It is described on oral cholecystogram and MRCP, and it is because of filling of contrast or fluid in the intramural mucosal diverticula, which are basically dilated Rokitansky-Ashkoff sinuses, and they are lined up to give an appearance of pearls on a necklace. What is happening here? What kind of sign we are seeing here? This is crazy paving appearance, which is because of diffuse ground glass opacities in the lung parenchyma with superimposition of interlobular and intralobular septal thickening. It is seen on HRCT chest or CT chest in lung window setting, and the causes include most common cause is pulmonary edema. Next, you can find this in ARDS and viral pneumonia of unknown etiology, and in pulmonary alveolar proteinosis. What is happening in this radiograph of finger? Well, this is pencil and cup deformity, which is generally described in psoriatic arthritis. So here we can see there is central erosion of a phalanx, and another phalanx which is forming a joint with this is giving a basically pencil and cup deformity. So this is generally described as psoriatic arthritis, but it can also be seen in systemic sclerosis. Next case, what is happening in this CT of vertebral body? So this is picture frame vertebra. It is because of peripheral sclerosis in the vertebral body, and it is seen in Paget's disease. So picture frame vertebral body is basically because of thickening of the cortex of the vertebral body, and it is seen in Paget's disease. What is this appearance called as? Rugged Jersey spine, and it is seen in renal osteodystrophy, which is generally because of chronic kidney disease. What is this appearance called as? This is sandwich vertebra. It is similar to the rugged Jersey spine, but the osteosclerosis along the end plate are more sharply defined as compared to this. And this appearance, sandwich vertebra appearance, is seen in osteopetrosis. What is this appearance called as? This is gallbladder ghost triad, which is seen in biliary atresia. So this triad consists of three features of gallbladder, where we find atretic gallbladder, which is length less than 19 mm. The wall is irregular and lobular contour, and there is lack of any echogenic mucosal lining and the wall is completely indistinct. So this is gallbladder ghost triad, which is seen in biliary atresia. There is one more sign which is seen in biliary atresia, and that is triangular cord sign, and it is because of thickening of the anterior wall of right portal vein. So this is right portal vein, this is anterior wall of the right portal vein, and it is thickened and echogenic. So this is triangular cord sign. What is this sign? This is ultrasound of right hypochondrium showing liver which is completely hypoechoic, and there is increased periportal echogenicity, which gives a typical starry sky appearance, and this is seen in acute hepatitis. Starry sky appearance is also described in biliary hematomas or microhematomas because of presence of multiple von Manberg complexes on MRCP sequence. Starry sky appearance is also described on DWI sequence in cases of multiple cerebral fat embolism. So this is because of multiple foci of acute infarct, micro infarcts in the brain. What is happening in this case? This is chest radiograph PA view in a pediatric patient, and it is showing the bulbous anterior end of the ribs on both sides. Plus, you can see presence of metaphyseal flaring and cupping. So this is a case of rickets, and this is ricketic rosary. So it is because of expansion of the anterior ends of the ribs at the costochondral junction, which appears nodular. What is happening here? The ribs are very thinned out, and they are basically like ribbon rib. So this is ribbon rib deformity, and it is because of presence of multiple neurofibromas in a case of neurofibromatosis type 1. Along the intercostal nerve, you can find multiple neurofibromas, and they cause pressure erosion of the ribs and lead to ribbon rib deformity. This is a different patient, again showing similar ribbon rib deformity. You can see thinning of the ribs, presence of multiple soft tissue masses here, which represent neurofibromas. What is this case, and what is the sign here? This is stack of marble sign or marbles in a bag sign. It refers to aggregation of multiple small globules of fat which are hyperechoic on ultrasound, and it shows fat signal intensity on MR, and it indicates dermoid cyst in the head and neck region. So this is stack of marble sign in dermoid cyst. Name the sign here. This is sail sign. So you can see here a sail-like structure is seen in the lung, and so this indicates left lower lobe collapse, and this is the sail sign. Sail sign has also been described in other parts of the body. For example, in this elbow radiograph, lateral radiograph of elbow, you can find tail sign here, anteriorly as well as posteriorly, which indicates elbow joint effusion, which is causing uplifting of the fat pad, giving sail sign. Normal thymus in a pediatric patient can also give sail-like appearance. So this is thymic sail sign. When there is pneumomediastinum, the air lines the thymus completely, and it gives an angel wing type of appearance. So this is angel wing appearance of pneumomediastinum in a neonate. What is happening in this sagittal MRI T2 weighted sequence? This is scalpel sign. So scalpel sign is described in dorsal thoracic arachnoid web, and it is because of focal distortion of thoracic cord, which appears anteriorly displaced, and it mimics the profile of a surgical scalpel. What is happening here? So this is CT lung in the lung window setting. You can find horseshoe-shaped lung. So what is horseshoe-shaped lung? This abnormal extension of the lung parenchyma. The band of lung parenchyma is extending between the right and left lung. It bridges both the lungs, and it is seen anterior to aorta and posterior to the heart. And it is often associated with scimitar syndrome. So this is horseshoe-shaped lung. When we are talking about horseshoe-shaped lung, that's a word about horseshoe-shaped kidney. So this is IVP of a patient with horseshoe-shaped kidney showing which sign? Hand holding calyces. So the calyces are basically joined together. So this appearance is known as holding hand calyces. Horseshoe-shaped adrenal is also described, which is a very rare abnormality. So this is horseshoe-shaped adrenal gland. So both the adrenal glands are fused and they are midline. Horseshoe-shaped pancreas is also described in literature, and it is because of abnormal elongation of the uncinate process, which extends all along the tail of the pancreas. So this is horseshoe-shaped pancreas. Next case, what is happening here? This is a radiograph of a pediatric patient showing the pelvis and the lower lumbar spine. And what we are seeing here is tombstone iliac wings or Mickey Mouse ear pelvis, which is an imaging descriptor of iliac wings in patients with achondroplasia. So in these patients in achondroplasia, the iliac wings are small and squared, and so they look like tombstone or ears of Mickey Mouse. So this is tombstone iliac wings in achondroplasia. What is happening in this abdominal radiograph? In the erect abdominal radiograph, we are finding multiple fluid level giving step ladder sign or string of pearls sign, and it indicates mechanical small bowel obstruction. What is happening in this positive upper GI contrast study? Do you find anything abnormal here? There is bowler hat sign. So you're seeing here a certain area of radiolucency, which is projecting towards the lumen. So this indicates a polyp. So bowler hat sign is described in both polyp and diverticular. It depends on the direction. So if it is pointing towards the lumen, it is polyp. It is pointing away from the lumen, then it is diverticular. So this is bowler hat sign. What is happening in this radiograph? This ICU patient is having subcutaneous emphysema and pneumomediastinum, and this is showing compression of the heart. So this is earth heart sign, which is a sign of cardiac compromise, and it is seen in chest radiograph of patients with tension pneumomediastinum. Let's have a look at another kind of appearance where heart looks like an egg. So this is egg on a string or egg on side, which refers to transposition of great arteries. So in this, heart appears globular because of abnormal convexity of the right atrial border, and the superior mediastinum is basically narrowed because of stress-induced thymic atrophy and hyperinflation of the lung. So this overall appearance, it looks like egg on a string sign, which indicates transposition of great arteries. Let's see what is happening here. So this is bucket handle fracture. So this indicates metaphyseal corner fracture, also known as bucket handle fracture, which is described in young patients, pediatric age group, often less than 2 years of age, who suffer from child abuse or non-accidental injury. So this is basically, you can see here, this is bucket handle fracture. A number of other injuries are also described in cases of non-accidental trauma, which is also known as shaken baby syndrome. So the injury can affect brain. It can lead to rib fracture. It can lead to metaphyseal corner fracture. So like this case, there is metaphyseal corner fracture, rib fracture with callus formation of different ages. And there can be transverse or spiral fracture of long bone. Plus, you may find discrepancy between the history given by the parents and the age of the fracture. So you may find callus in apparently young trauma. There are multiple other injuries which are described in brain, like intraventricular and subarachnoid hemorrhage, subdural hemorrhage of different ages, and parenchymal laceration and tadpole sign, which is basically venous thrombosis leading into the intraparenchymal hematoma. So this is tadpole sign. So all this indicates non-accidental injury or child abuse. What is happening in this infantogram? So we are finding here telephone receiver deformity in the shaft of long bones, which is because of bowing of femur and humerus, and it is seen in thanatophoric dysplasia. So thanatophoric dysplasia is basically most common lethal skeletal dysplasia, and it has two subtypes. In type 1, there is marked underdevelopment of the skeleton, and the long bones are bowed and telephone shaped, handle shaped. And in type 2, the limb shortening is not that severe, but the skull is deformed. So skull takes the shape of a clover leaf. So this is type 2 thanatophoric dysplasia, in which you can find clover leaf shaped skull. Next, two different cases, but showing different, same pathology. So this is ultrasound pelvis showing uterus. What kind of sign you're seeing here? It is Venetian blind appearance or rain shower appearance, which is a sonographic finding associated with adenomyosis of uterus. It can also be seen in uterine fibroids. So this is basically, you can find multiple hypoechoic shadows here giving rain shower or Venetian blind appearance in a case of adenomyosis or uterine fibroid of uterus. What is this appearance called as? Which is this study? This is retrograde ureterogram showing goblet sign or champagne glass sign. So it is because of focal dilatation of ureter by an intraluminal mass, and it is opacified by retrograde contrast. And the presence of this sign indicates that the pathology is chronic, and it is most commonly seen in transitional cell carcinoma of ureter. What is this sign? This is keyhole bladder. So keyhole sign is a sonographic sign seen in exclusively in male gender. So in boys with posterior urethral wall. So you can see dilatation of urinary bladder and posterior urethra giving keyhole sign. What is this appearance known as? Chest radiograph showing bag of water sign, and this indicates very large pericardial effusion. This radiograph of neck in a pediatric patient is showing steeple sign. So basically, it is because of crow, which leads to narrowing of the upper trachea. So there is tapering of the upper trachea, which gives an appearance of steeple or inverted V sign, and it indicates crow. What is happening in this CT of skull? This is known as mosaic appearance, and it is seen in Paget's disease. So it is basically because of mosaic attenuation in the calvaria, giving jigsaw pattern. There are some other appearances also being described in Paget's disease, like in this radiograph, we can see cotton wool appearance, where multiple foci of osteosclerosis are noted. So this is cotton wool appearance. There's one more appearance which is described in Paget's disease, and that is Tam o' Shanter hat. So this calvaria basically takes an appearance of a hat. So this Tam o' Shanter hat. When we are talking about mosaic appearance, let's have a look at this CT chest lung window, which is showing mosaic attenuation of the lung parenchyma, which is also known as head cheese sign, and it indicates chronic hypersensitivity pneumonitis. What is happening in this lumbar radiograph lateral view? You can see central beaking of the vertebral body giving bullet appearance. So this is bullet-shaped vertebra. It is because of anterior beaking, and it is seen in mucopolysaccharidosis, Hurler disease, body Q, achondroplasia, and multiple other conditions. What is happening in this CT? You can find arrowhead sign. So this arrowhead sign is because of focal cecal thickening, which is centered on the appendiceal orifice, and it gives an appearance of arrowhead sign, and it is seen in acute appendicitis. What is happening in this intravenous urogram? Delayed image, you can see the bladder is irregular in outline and it is quite small in capacity. So this is thimble bladder, and it is because of extreme fibrosis and contracture of the bladder wall, which results in tiny bladder, and it is seen in advanced cases of genitourinary tuberculosis, rare nowadays. What is happening in this MRI brain? We can find hockey stick sign, which is seen in Creutzfeldt-Jakob disease. It is because of this hyperintensity here. So there is hyperintensity along the medial thalamus and in the pulvinar region. So this forms an appearance of hockey stick. A similar appearance is also described in Wernicke's encephalopathy. Hockey stick sign is also being described in thyroid hemiagenesis in a case of nuclear scan. What is happening in this brain MRI brain DWI axial sequence? You can find a small focus of hyperintensity affecting the splenium of our corpus callosum, and it is giving an appearance of boomerang. So this boomerang sign indicates cytotoxic lesion of corpus callosum. Boomerang sign has also been described in musculoskeletal system, where we find, splitting posterior to the lateral malleolus. We have two tendons, peroneus brevis and longus. So when there is a splitting of peroneus longus tendon actually invaginates in the peroneus brevis, and this peroneus brevis, it takes the shape of a boomerang. Boomerang sign has also been described in MRI knee in cases of horizontal meniscal tear with displacement. So this is displaced horizontal meniscal tear, which gives an appearance of a boomerang. What is this sign known as? This is again a string of pearls sign because of watershed infarction. So this indicates watershed infarction at the between the territory of penetrating cortical arteries and ascending perforating arteries. So this is deep water border zone watershed infarct. String of pearl sign is also been described in fibromuscular dysplasia in renal arteries. So this is a renal angiogram, conventional angiogram, which shows multiple nodular appearance of the renal artery. So this is fibromuscular dysplasia, which is affecting renal artery. This is a string of pearl sign in a case of polycystic ovarian disease, and this is ultrasound ovary. Multiple small follicles are seen in the periphery, giving string of pearl sign. What we are seeing in this radiograph of calcaneum, this is cockade sign, and it indicates intraosseous lipoma with central calcification. It's classic appearance of calcaneal intraosseous lipoma, and you can often find a focus of calcification in the center. What is happening in this abdominal radiograph? You can find thickening of the mucosal folds. On this CT also you can find submucosal edema, extensive submucosal edema affecting the large bowel loop. So this is accordion sign or concertina sign, which indicates thickened edematous wall of pseudomembranous colitis, and it has been reported to be a specific sign of Clostridium difficile colitis. However, it can also be seen in non-specific colitis and ischemic colitis as well. What is this appearance known as? This is cannonball metastasis in the lung, which indicates metastasis from like osteosarcoma and choriocarcinoma. It can occur from any primary. So the metastases are very large and round shaped, giving an appearance of cannonball. What is happening here? This is Mercedes-Benz appearance or Mercedes-Benz sign, which is described in triple barreled aortic dissection, in which we can find 3 lumen. So out of these 3 lumen, only one is going to be true lumen, other 2 are going to be false lumen, and it is because of secondary dissection in the wall of false lumen. Mercedes-Benz sign is also described in cases of gallbladder calculus, where there is air trapped within the calculi. And an inverted Mercedes-Benz sign is also described in spinal subdural hematoma because of presence of denticulate ligament and a dorsal septum. So this hematoma takes the shape of a inverted Mercedes-Benz. What is happening in this lateral radiograph of the wrist? This is spilled teacup sign, which is described to show the volar displacement and tilt of dislocated lunate. So lunate is basically dislocated and it is directed towards the palmar aspect, and it is no longer in articulation with the radius and capitate. So this is lunate dislocation giving teacup, spilled teacup sign. What is this appearance known as? This is a piece of pie sign, which refers to abnormal triangular shaped appearance of lunate on a wrist radiograph. So this piece of pie sign indicates either lunate or perilunate dislocation. But to differentiate between these two entities, we need a lateral radiograph of the wrist. So in cases of lunate dislocation, you will find a spilled teacup sign, whereas in case of perilunate dislocation, you will not see this spilled teacup sign, but piece of pie sign will be seen in both the entities. What is happening in this lumbar radiograph? You can find a radiodense line in the midline giving dragger appearance, and you can also see bony ankylosis of bilateral sacroiliac joint. So this is an advanced case of ankylosing spondylitis, where there is ossification of supraspinous and intraspinous ligament giving dragger sign. There is another patient of ankylosing spondylitis in the early phase, where you find shiny corner sign and ruminous lesions. So ruminous lesions are basically erosions at the end plate and the corners, and shiny corner is sclerosis deep to it. So this is shiny corner sign or Romanus lesions. You can also see thin desmophytes, which are thin linear ossification, which bridges along the intervertebral disc. So these are thin desmophytes, which indicates seronegative spondyloarthropathy. You can also see Anderson lesions in ankylosing spondylitis, which is basically spondylodiscitis type of appearance, which affects end plate as well as intervertebral disc. In late stages, you may find complete fusion of the spine, giving bombo spine appearance. And this kind of spine is very fragile. It can fracture very easily. And this fracture is also described by a very interesting name. So this is chalk stick fracture or carrot stick fracture. So we'll continue with the other signs in the next video. Thank you.